Hi, my name is Anissa Pizano, and I will be doing my program evaluation on Choose Health LA ChildCare. To begin, Choose Health LA was created and will be evaluated based on their purpose to improve the nutrition and physical activity in children ages 0 to 5 in a childcare setting by supporting healthy habits and development in children, parents, and childcare providers in LA County. Because childhood obesity has become a really common problem in today's society, the goal of this program evaluation is to evaluate the results it has on reducing the prevalence and obesity and overweight in childhood, specifically children in childcare, and getting a head early start on preventing childhood obesity. The objectives for this program evaluation include the following. The first objective, which is to analyze and assess the improvement of nutrition and physical activity practices in child care centers and homes by analyzing the type of nutrition and amount of physical activity being done by these children. And the second objective, which is to understand the program implementation, which include the successes and challenges that are faced by the program facilitators, as well as the children participants and their child care providers and parents. Third objective, it's going to be to improve childcare providers' communication with parents about nutrition and physical activity related policies and how these types of nutrition and physical activities can be implemented into a child's lifestyle. So next we'll go on to discuss the background behind the epidemiological data on childhood obesity and overweight. So according to the CDC, children ages 2 to 5 are categorized as being obese or overweight, having an 18.5% of them being overweight or obese. Children 2 to 4 years old who have obesity or an overweight classification is between 15.3 and 15.8%, which is relatively a good amount for those children who are barely in their early years of life. So the effects of obesity on children increases the risk of developing many health conditions. These health conditions include the following: heart diseases such as coronary heart disease, strokes, high blood pressure, to include some. Other health effects that can be high at risk for children with obesity also include type 2 diabetes, cancer, liver and gallbladder diseases, infertility issues, as well as mental health problems about self-image about those children. These conditions are all at increased possibility in later developing in children as they become adolescents and adults, so it's easy to start early and get an early prevention program for children. Health disparities with children who are obese. There are many health disparities. Children that are American Indian or Alaska Native, Hispanic, and African American have a higher increased chance of being categorized as obese than compared to children that are Asian or white. Also, male children have a higher prevalence of being obese than female children. And income also has an effect on childhood obesity, as children whose families who have an income of 0 to 99% of FPL or FPL being the federal poverty level have a higher prevalence than children whose family income ranges from 200% federal poverty level and above. Also, children living in larger cities have a higher chance of being obese than those living in suburban residences. Comparing the numbers, large cities have 18% prevalence of children with obesity compared to suburban residents with 13.7%. Methods. So the methods that are going to be done for this evaluation is picking a population. So with Choose Health LA, it has a target focus of children between the ages of 0 to 5 living in LA County. They also target children who are in a child care program or early care environment. So another primary focus in this evaluation are racial and ethnic minorities, as well as children that come from low-income families or communities, as those are communities that are more heavily hit and more at risk for developing childhood obesity. And participants will be selected depending if they fit into the criteria of the chosen ethnicity or race, low-income financial status, and their eligibility to speak both English and Spanish. And the sampling method is that a representative sample will be selected as a simple random sample. So 100 children from the ages 0 to 5 will be chosen, as well as their parents and child providers will be included in this evaluation. Now, the evaluation design is to determine the meaningfulness of the program and the effect that it has on the participants. So the program procedures will be implemented by evaluators of the Choose Health LA ChildCare program. Measurements and data collection will be gathered at the beginning of the evaluation and post-evaluation to determine the effectiveness of the program. So this will be done through a true experimental design with pre-test and post-test as the chosen methodology. Because of the benefits of the pre-test is to set a baseline in comparison between a control group and experimental group, and a post-test would also be administered at the end of the evaluation to compare between the two groups as well as to make conclusions from the pre-test. Now, any differences between the pre-test and post-test can be used to refer to the type of intervention your group was in. The data collection methods that will be used in this evaluation will be through observation and a self-administered questionnaire or survey. The use of observation will be used to determine how many participants were involved in the program and workshops provided, and a self-administered or survey will be given to children, parents, and child care providers to provide information about the program and given materials. This would help give a better understanding of how children are changing their behaviors and attitudes towards physical activity and their nutrition through the program. And questions asked in the surveys are going to include questions about demographics, knowledge questions about nutrition and physical activity, as well as attitudinal questions, which will be based off how children view their eating and exercising lifestyles. So based on the information provided in the workshops and how they have been implemented, there will be able to be a reflection of how children are reacting to the program. So the program evaluation is that each participant will complete a pre and post test and survey. They will be asked questions about the program and the effectiveness of it, and each answer will be recorded and documented onto a data sheet, and the data sheet information will be transferred to a data collector such as a statistical software. And so some statistical techniques that will be used to gather the descriptive statistics or univariate analysis will be through gathering information from the demographics given from the sample population, and these demographics will be measured through frequencies and percentages and will be reported as categorical and nominal data. The frequency tables and bar graphs will be used to report these variables as well as the mean and the mode. And frequency distributions will be used to report answers and responses to the knowledge questions and attitudinal questions, taking the mean and mode of responses. A line graph and bar charts will be used to report these variables, which are both nominal and ordinal. And other types of statistical techniques is to gather any inferential statistics or bivariate analysis, and this will be done through using pair t-tests to compare the independent and dependent groups, the groups being those that were taking a part in the program and those who were not involved in the Choose Health LA ChildCare program. So for the dependent variable, the amount of children that change their views, attitudes, and beliefs about nutrition and physical activity through pre and post test surveys will be calculated through percentages, and the independent variable will be the health interventions about nutrition and physical activities. And that concludes my presentation on Choose Health LA Childcare and the program evaluation done for it. Thank you.